hurts because you touched me. And I'll tell them, touch me anywhere as hard as you want. Go right here, or wherever it might be, and they'll dig your elbow in me. And if it doesn't hurt just because you're touching it. Right? There's something going on there that really hurts. If you sit all day long and you don't stretch, and you've got poor biomechanics and lower back pain, and my quads are tight because I never do anything, all I do is run, and you don't do anything maybe for like the posterior chain of my muscles, my hamstrings, my glutes, my lower back. These things will crank on my lower back, cause all types of problems in here, lots of pain, lots of problems. You go in here on yourself sometimes, like right inside your hips, you're like 2 inches away from the belly button. Kind of get that kidney out of the way, press in there. Very, very uncomfortable. We'll work on those a lot. If you want to do something like that, you can lay on your stomach and put this tennis ball. You'll feel where your hip is. And here's the belly button. So somewhere in between here, usually right in here. This is the best way to do it, but you kind of lay on your stomach right in there, move around. It goes from your spine, right in here, to over my knee. It kind of joins in with my patella tendon and everything. So that's a pretty big muscle. All day long I sit, and that thing gets shortened. And that causes a big problem with a lot of athletes that we see, not a golfer, a tennis player, a baseball player, football player, that needs to have explosive movement of their hips, and they just can't, because this thing is 80 hours a week you spend sitting in school or whatever it might be, or at work. These things are short and will cause a tremendous amount of torque on the lower back pain. So working with those, most people will go to a good massage therapist would look here, but some physical therapists would look here, but a lot of people, you'll say I have lower back pain, and they start to chase the pain in the lower back, and they look up and down your back for it, and they don't look to any of these muscles up in here, okay? And then that just brings us to the last two, which are the glutes. On this here, the big one back here is a problem, but more specifically the one on the side. You feel where your femur head is, and you kind of feel in there. You get on your side, and I would use a tennis ball for muscles around the hips, and a foam roller for here to here, and my lats. I use a tennis ball for all throughout my back, upper back, pecs, and here. Again, like we talked about before, people are at a desk all day, hunched over. These are tight, causes all sorts of problems for the upper back. Laying on your side and getting this tennis ball. Again, you can feel like the crest of your hip. You know, some people keep their pants up there, some people are a little bit lower. But this crest of your hip right in here, you lay on your side, and you can get that tennis ball all from that crest of your hip, and like this triangle form from where my hip is, like this, all in there. Some pretty nasty pain sometimes, radiating pain down into the leg, will cause a lot of knee pain, hip pain, back pain, can mimic all sorts of different types of dysfunctions. Getting rid of these trigger points will decrease pain, decrease headaches, decrease, if it's in the neck or upper back, decrease a lot of this referred pain, and allow you to get proper mobility, proper range of motion. If joints are moving, think of a joint that's not moving properly, like a door hinge. We're in the office, I just take the door, and we're talking to the patient, I swing it open and shut. Think of joints that aren't moving properly like a hinge on a door. If they're not moving properly over time, if I change that middle hinge, so now those bolts aren't swinging properly in that middle hinge, it's going to wear down, it's going to wear down, it's going to wear down. And that's why I get maybe a lot of times my bursitis, maybe my tendinitis, maybe my arthritis, and all those different types of pain and problems. And I'm going to take my Vioxx or my Celebrex or my injections and not do other types of either exercises. Exercise is good for these things. We don't, unless we think that we're going to cause more harm, we have people exercise. We'll scale it and they won't do things that are going to injure themselves. But unless we think that they're going to do more harm, we're going to allow them to continue to exercise, because a lot of times those movements and the strengthening of those areas is what's going to help a lot of those people heal the quickest. I've got some information up there, some pamphlets, some cards, and then I do every month we do a free soft tissue class. Usually it's just for our members and patients, but this February we're gonna open it up. We put it in some of the running stores. So we'll try to keep it to about 40. We have 2 or 3 me and other doctors and massage therapists that go over using the foam roller, using bands to stretch and help with mobility, PVC pipe, tennis balls, golf balls, lacrosse balls, baseball, whatever you got. We'll try to teach you how to use it in some type of systemic fashion to help with some of these things. There's some flyers up there. If there's not enough, you need more, you can grab my email and I can send you the email. It's going to be on a Saturday after one of our classes. You're more than welcome to join us for the class and then do that. There's a lot of information on our website about the cross center, about the doctor's office. If you have any questions, you ask me now. If you have anything you don't want to ask me, you don't want to ask like in public, feel free to email me and I'll get back to you as soon as we can. All right? You good? Sure.
QL, do you have?
That's actually on my list.
Oh.
Let's go over it.
Okay. That's one of my.
It's on my list. I just didn't go over it because.
That's one of the hardest ones.
Yeah.
At least I have with my clients
Yeah.
on how to help them.
Yeah. QL is like it's a pretty deep muscle and it's really close to the spine. It's really close to the spine. Keep moving. Really close to the spine here, and it goes from like here over this area to the top of the hip. Difficult to get to. We'll usually just have people get this tennis ball into the lower back and kind of run it down around the hips. A pretty good generator of pain. Will mimic a lot of like hip bursitis and different problems like that. The reason why I didn't go over it is because there are some muscles that it's much easier for me to manipulate the patient or the athlete into a position to get at it better. Same thing like with the hip flexors and stuff. Than just saying go at it with this thing. But yeah, that's one that we usually like. We'll give it a shot for them, but usually it's kind of hard for them just how anatomy is, and you've got layers and layers and layers of muscles, so we need to move stuff out of the way in order to get to what we think might be causing the problem. Anything else? Good? All right. Thank you.
Thank you. Yeah. Thanks, Brian.